Hey everybody, happy Friday. This is Dr. Phil with Total Performance Physical Therapy. Today we're going to talk about low back pain and some simple things we can do to help manage it when we have it. Now, before we go into those strategies, I want to kind of illustrate why you might be having back pain with just a simple drawing I did. I'm no Picasso, but here we go. So you're having low back pain. Why? Well, a lot of times pain follows the disc model of the low spine and why we get pain, and that means that the pain is involved because of something the intervertebral disc is doing. The disc is that space you have between your vertebrae. It's that cartilaginous disc, and it's filled with fluid. So here we're looking at L4, L5. That's your two lowermost vertebrae in the spine. And what can happen sometimes is this disc can get disrupted and push into your nerves that you see right here. So what does that mean? So if this disc is pushing back, if we flex forward, imagine these two vertebrae are squeezing together in the front. And if this disc is getting pushed in the front, it's going to push that disc back into the nerves. So if we're bending forward and we're experiencing more pain, maybe if we did the opposite motion, extended back, we could push this disc and send the contents back. And that's what a lot of the research shows. So to do this, to make it so that we get this disc going back to where we want it, away from the nerves, away from where it's causing us pain, we do extension biased exercises. So there's nothing too complicated with doing extension biased exercises. You can easily do them at home or anywhere really. You don't need any equipment, just some simple instructions. So if you're doing this for the first time, the easiest thing you can start with is just lying flat on your stomach. Not sleeping on your stomach all night, but just finding that flat position on your stomach, and we're seeing if it's going to take our pain away. And a lot of the times, this is a good strategy for that. So lying on your stomach is just like what it sounds like. You're going to lie flat on your stomach with your arms at the sides. Give yourself a couple of minutes, see if that's feeling better. Let's say 2 to 5 minutes go by, you're like, okay, my pain's feeling better. What does that mean? So you could have less pain in the low back. If you're having symptoms coming down the legs, those symptoms could be centralizing. So any pain that was going down either leg may now be coming up, and that's a good thing. Anytime we can get that pain to come closer to the spine, that's what we want. So we did lying on our back. So let's say you laid on your back, or I'm sorry, laying on your stomach. Let's say you laid on your stomach, but the pain, you still have a little bit coming down towards the butt. It went up the leg and now it traveled up to your butt. Let's get a little more extension. So now instead of laying flat on your stomach, you're lying flat with your elbows. So you're lying on your stomach, supported by your elbows. Wait some time again, 2, maybe 5 minutes. So maybe now, the pain is up to the spine. You no longer have it in the butt or the lower leg, it's traveled up to the spine, but you still feel it. So now let's try to get even more extension. So we'll reset our arms, reset our hands, and now we're in a position to where we can do a prone press up. Your hands are under your shoulders and you can come up. Getting that extension in the spine, and then come back down. Try 10 of them. So you'll come up, and you'll come back down. Notice how my hips are staying down on the table. I'm not raising them up like that. They're staying down here. Nice and easy. This shouldn't be fast and explosive. Smooth, slow, in control. And let's say you've done your 10 and your back pain's decreasing. You may do more. Let's do more than 10. Let's get rid of that back pain. And now you're at a point where, okay, I've done all of these. Let's say I've done 20. I almost have no back pain. If you're on a table or let's say a firm mattress, you can come off of it now. So the way I like to get off of it, we don't want to start bending the spine because that's what's causing us the problem to get off the bed. We want to get off the bed keeping our back straight. So you'll slide off to the side, drop the leg down, my back is still straight. Push off the table, swing the other leg down, and I did a pretty good job of keeping my back straight. So once you've done everything in a prone position, then you'll progress to doing things in standing, so standing extensions. So that pain might be almost gone, now you're standing, you're feeling pretty good, you may not want to mess with it, but let's try to totally get rid of it. So now, hands right on the belt line. You're looking forward, body's nice and tall, nice and straight. You're going to extend back. I'm not really feeling anything yet. Keep going. Every time you go back, if you can go a little more, try to go a little more. Keep progressing. And oh, you know, you may feel a little weird. You're not used to not feeling pain. I feel pretty good. There's no pain. And then now you've eliminated your back pain. So that's a simple progression of how you can manage your low back pain. So it might be really intense when you first start it. Try just, our first step is try laying flat on your stomach. Give it time, see what happens. If it feels better, progress it to the next step. Lying prone on your elbows, on your stomach, on your elbows. See how that happens, see what happens with that. Gets better, then keep pressing up. Try the prone press ups. That's the next phase. That takes the pain even more, or it's centralizing and coming up the legs into the spine. That's great, that's all good, that's what we want. Once you've mastered the prone press up, then we can do standing lumbar extensions, which is what I just demonstrated. And then if you can find a way to manage it by doing those simple exercises, that's great. There's no real set number of sets or reps of these. You really hold these positions until you notice a change. You do the extensions until you feel something get better. With all that being said, if you're doing these and it's not getting better or it's getting worse, stop. Then what do? You come see me, you see a physical therapist. We talk about it, we put you in different positions, we analyze things, we'll figure it out. Maybe there's something else going on, maybe there's different positions that will be more appropriate for you. I hope this answers some of your questions about how to treat low back pain on your own. If this, again, does not work for you, that's why we're here. That's why Total Performance Physical Therapy is here. We have great physical therapists that are always available to help you out. Hope you have a great weekend. I'm Dr. Phil. Take care, guys.